Well, there's a whole variety of new agents in CLL. For a period of time there, the response rates we were seeing with BTK inhibitors and BCL-2 inhibitors led us to believe, well, where is there space for new agents to become and being approved? Well, we're seeing next generation BTK, next generation BCL-2 inhibitors. We're also seeing different classes of agents, things like MALT1 inhibitors being added in. And of course, we're also seeing a lot in the immunotherapy space in terms of bispecific antibodies, which in the past had been associated with higher toxicity profiles in CLL patients. But by using the agents subcutaneously, as we're seeing at this meeting, we're seeing it can be much better tolerated in CLL, and we're starting to see good responses. And of course, still experimental are the CAR T approaches which are being used in CLL, which again, immunotherapeutic approaches, very interesting, particularly as we think about if we're using all of our best agents together up front, like using an ibrutinib-venetoclax combination, we have to have things in place. We're also seeing at this meeting further follow-up on the LOXO studies using pirtobrutinib, that next generation of BTK inhibitor, which seems to be able to overcome those patients who become resistant to the so-called covalent binding BTK inhibitors, and that's also looking quite exciting and filling up a gap we have in the need for our patients.